I'm LaShell. I've been a Bowen therapist for over 30 years. Bowen Therapy is alternative pain relief. This is Carissa. We're going to show you how to get relief from your TMJ problem. So what is TMJ? That refers to the temporomandibular joint, the joint between the upper jaw, or your skull, and the lower jaw. These problems cause clenching of the teeth, pain on chewing, eating. They are function in Bell's palsy. We're going to show you how that you can get relief from these problems. A few simple moves. The TMJ problem itself is considered caused by muscle tension, but it also causes muscle tension, so it's complex, but it's not difficult to get relief. The first thing we're going to work on is the scalene muscles. These are large muscles that come up the neck and end at the ear behind the jaw. They're very responsive to stress. They will tighten up under any kind of stress and cause problems. So what we're going to do is simply turn our hand backwards, and we're going to push just above the collarbone right there on that muscle. You can hook your fingers behind your neck to give you a little more horsepower, and you want to push with your thumb backwards for a count of roughly 10 seconds. Then, without taking the pressure off, move your thumb to the outside. Then do the other side. And then the next one that we're going to do is the Bell's nerve, right here where your glasses would sit. This is actually part of the trigeminal nerve, cervical nerve number 7. These are the nerves that operate all the facial functions. They tighten up. They're tied down here as well. So what we're going to do is right here where the glasses would come out, we're going to push inward and make a cross. A little bit of pressure. Now we're going to do the lower half of the trigeminal nerve itself. We're going to come just ahead of the ear lobe, the mylohyoid, and we're going to put pressure inward, move the slack up, move down, and press to the rear. The pressure goes to the rear of the head there. Hold it for a few seconds, 5, 6, 8 seconds, and then let it go and do the other side. Then the next thing we're going to do is the masseter muscle. We're going to move our hand and do 3 moves. We can use our thumb again. The masseter muscle is right here. It's the muscle that closes your jaw, and it's often way too tight, and it's angled between the lower and upper jaw. So you can use your thumb, start here just below the cheek, and push backwards across the edge of the muscle in about 3 places, okay? And then you can do the other side. The next thing, you'll need to move your jaw a little bit. Move it over to the left, and you're going to take your hand, and right there where the jaw joint is, you're going to make a big circle. Push in with some pressure and make a big circle. All right, then do the other side with the jaw rotated to the right. We have one more exercise. You can do this as often as you want, but it's a good idea to maybe twice a day, once when you get up, once when you go to bed. Do the exercise by washing your hands first. Take your index finger, put it inside your mouth on the external side of your teeth. Come back here where your lower and upper jaw meet. and you'll find that if you push outward, the masseter muscle is right there, and it should probably hurt if you have a problem there. Push outward for 20 to 30 seconds, and then let it go and do the other side. These are ways that you can normalize your jaw and get rid of all the pain and misery. It also is a factor, as I said, in Bell's palsy, because what is considered Bell's nerve is really the trigeminal nerve, cervical nerve number 7. And when that nerve is compressed or has any pressure on it or is inflamed or anything, one side of your face or the other gets distorted, or you lose control of it. So this will help. This will help. Also, another minor function of this is eye problems. Blurred vision, those things due to muscle pressure on the eye and the optical nerve. So give this a try. I'm sure it'll work. Thank you.